Good afternoon, everyone. I'm Douglas Hoey, CEO of the National Community Pharmacists Association. I'm out here in front of the United States Supreme Court. We're prepared for a historic day tomorrow in the Rutledge versus PCMA case. This is a day we've been waiting for a long time. I'm here with my colleague John Vinson, CEO of the Arkansas Pharmacists Association. John?
Yeah, thanks, Doug. It's good to see everyone this evening. It's a beautiful day in Washington, D.C. I don't think we thought this day would ever get here, but we're excited to be here. We're looking forward to a historic Supreme Court case tomorrow about pharmacy and, most importantly, our patients that we serve.
You know, John, it's been a long road to get here. But this is the first time that PBMs have been, unbelievably so, that PBMs have been called out in front of the highest court in the land to do some splaining.
I totally agree, and it's about time. We've been working on this, of course, in Arkansas since 2003 was the first year we attempted legislation. It took until 2015 to have something meaningful passed.
Yep.
I know a lot of other states, you'll talk about this, went alongside us, and since then, and we're excited to have all of us rowing the boat the same direction to bring this light, to bring this sunshine. Sunshine's a good disinfectant.
Yeah, you know, and that's the one thing the PBMs hate the most is sunlight. They'd rather kind of stay off in the shadows and not be seen by anyone, kind of operate in the background while they're operating their multi-billion-dollar operations and extorting money from pharmacies, extorting money from manufacturers, extorting money from everyone because they're the consummate middleman. So this day is an important day, and tomorrow we'll see PBMs finally have to explain how is it that the United States has the highest drug prices in the world, and the United States is the only country in the world that's handed their prescription drug benefit management to PBMs. Seems like more than a coincidence to me.
Doug's not exaggerating when he says billions of dollars. The three largest PBMs revenues are approaching $500 billion, and now that they're vertically integrated with health insurance companies, the seven largest, and I think Modern Healthcare just a few months ago, their revenues are approaching $1 trillion. So this is literally a case about access of care to the preferred pharmacists and local communities versus $1 trillion healthcare industry that doesn't want that to happen.
Yeah, you know, John, you mentioned the shadows. And I think it's interesting to think about how PBMs started because, one of the arguments that the PBMs make is that we're just over here in the shadows. Don't mind us. We're just over here processing some claims. And if you think back to where they started from, back in the 60s or so, they were claims processors.
Yeah, they were very similar to like a Visa or MasterCard transaction where they identified who the patient is, what benefit they had, and processed a claim, but they've grown much, much larger from just being a simple claims process.
Well, I mean, it's been like, this insidious growth. They've gone from this claims processor, maybe these small companies, and then they got a little bigger and a little bigger until, because early on pharmacies were able to process claims. It was, more of a, early, it was almost a convenience. And then now they dominate the pharmacies. They tell the pharmacies what to do. They tell the pharmaceutical manufacturers to do. I mean, pharma's the biggest lobby on the planet, and you've got PBMs bossing them around.
I totally agree. The three biggest are in the top 15 on the Fortune 500. Probably the most egregious thing that we're seeing now is they own their own pharmacies, both retail and mail, and they tilt the playing field to steer patients to their businesses. It's all about market share and all about steering patients to where the patients don't actually want to access care. And that's what we're fighting for, is for our patients to access care with the most talented healthcare providers, those providers that they trust and have relationships with.
Yeah, that's absolutely right. And with our guest today, we'll talk a little bit about provider status. We'll also talk about the impact on patients, because when you boil it all down, we're pharmacists because we want to take care of patients. And that's what PBMs are prohibiting us from doing, is being able to take care of patients, to help them get the best care at the best price. And instead, PBMs are taking money from every transaction. Every single transaction, the PBM never loses.
I totally agree. I got a call just today, an hour before we went on set, from a pharmacist who had $8,000 stolen over a silly audit issue where they were forcing the pharmacist to prove that the patient paid their copays with a check, and they don't have a copy of the check, and therefore we're going to steal $8,000 back from you, despite the care that this pharmacist is providing during the pandemic.
Yeah. Well, I said the PBMs never lose. Well, we hope this is the first time to change that, because for too long they have been the judge, the jury, and the executioner. This time they can't be the judge, jury, and executioner in front of these guys.
I totally agree. Excited to see what will happen.
Absolutely. Absolutely. So our first guest, we want to welcome our guests, and our first guest is Arkansas Pharmacists Association President and NCPA board member Kristen Riddle. Kristen's a great example of the collaboration between the Arkansas Pharmacists Association and NCPA from the beginning. In fact, NCPA past president Mark Riley was the architect, along with his top lieutenant Scott Pace, back in 2015 for this legislation. And that collaboration has continued to this very day. So welcome, Kristen.
Thank you. Thank you very much, Doug.
Kristen, glad you're here. We've got our first question for you this evening.
Thank you.
So wearing your hat as not only a member of our board, actually the president,
Yeah.
pharmacy owner, also a member of the NCPA board, talk to us about the case from both the Arkansas and the national perspective.
Yes, thank you, John. So this case originated from legislation that was grassroots in Arkansas to protect patient access. And the outcome of this case will impact patients and pharmacists across the nation.
Absolutely. So can you talk a little bit more about that, Kristen, as far as some of the impacts that you're seeing on, maybe pharmacists locally, but then pharmacists in probably every state across the country?
Yeah, absolutely. The onerous mandates by PBMs hurt patient care. I have an example in our state of a patient that was in and out of the hospital, and they were referred to their local community pharmacy, and the local pharmacy helped them with their medication adherence. The patient did fantastic in the local pharmacy, working with the pharmacist. And unfortunately, the pharmacy lost the patient to mandatory mail order. And now that patient is back in the hospital once they couldn't work with their community pharmacist anymore. This example is common in every single pharmacist or pharmacy and pharmacists across the nation. We just want the right to be able to continue to help our patients.
Yeah. Well, and in that instance, of course, costs are driven up and the health system pays more.
Absolutely.
And of course, that's one of the arguments that the PBMs make against this case, is that, you can't have if the Supreme Court successfully overturns the Eighth Circuit, that you'd have this patchwork of laws across the country that would increase costs. But in reality, you're seeing increased costs every day.
Absolutely. When the patient is able to work with their local community pharmacist, and the pharmacist knows when they're not getting their prescriptions filled on time, and they're able to step in and help that patient when they don't understand how to take their medication. But then when the patient has to work with a mandatory mail order situation and have their prescriptions mailed to them, and they don't have that local pharmacist they can walk in and receive help from, once that patient's back in the hospital, it really costs the health system a lot of money.
Yeah.
That's a broken system.
It is, yes. And when you have the community pharmacist that's able to work with the local physician, that's able to work with the local hospital, that brings it all together, that saves money.
Yeah, well, changing the pharmacy payment model, that's been one of our mantras, on the NCPA board. That was our theme last year for the NCPA annual meeting. And this would be a first step into changing that pharmacy payment model. Because one of the things that we see, not only for the higher costs, but you mentioned the care for that patient.
Yes.
And the care that was compromised for that patient. Can you talk, Kristen, a little bit, just speaking of care, about the pandemic? I mean, so community pharmacists have been on the front lines. We're essential healthcare workers, essential businesses. Can you talk maybe about some of the ways that pharmacists have been instrumental on the front lines during the pandemic?
Absolutely. So during a pandemic, when there's an emergency, that patient needs to be able to walk into their pharmacy.
Yeah.
They can't just wait on the medication to be mailed to them. They need their pharmacist right there. We are able to step in and we can take care of COVID testing if we need to. We can take care of local supplies, their medications, but we're there. We're right there in the community. And we're helping, not only helping with that patient that's walking in the door, but we're also helping with the local nursing home. We're helping with that patient that has a caregiver in their home and the caregiver doesn't know what to do during the pandemic. We're able to help that caregiver.
Yeah. One of the things we say is that, the PBMs would love healthcare to be on an assembly line. So if healthcare, if it's a one size fits all, everyone needs the same thing, it's always predictable, patients don't need customized care, the PBMs say, well, we thrive in that environment. But the reality, and you see it every day, Kristen, is that
Yes.
patients aren't widgets on an assembly line.
Absolutely not. I think that all of our viewers, all of us, we can think of our own family members, those that we love, and we know that every single one of them are not widgets on an assembly line.
Right.
They're very individual, their care needs to be individual, and we've got to be there, boots on the ground, to love on them, help the patient, help the caregiver. It is up to us.
Yeah, and God help us if that assembly line wins the day, because think of all those patients who don't fit on that healthcare assembly line that the PBMs operate, and the safety net that the community pharmacists provide to catch those patients who fall off the assembly line.
And with that, what would be the shame? It's not just the patient that hurts. So then you've got the family members of that patient. You have the clinic that you're helping, the physician, the local physicians, that poor clinic that you've been able to step in and help. Now they're burdened. It is a ripple effect.
Yeah.
I know the justices, they'll be studying the law and the details of the law, but I do hope they think about the human element of this.
Yes.
And the actual people impacted by their decision and not just about Wall Street.
Absolutely. Yeah. So, Kristen, having that that perspective as an NCPA board member and the perspective on the ground as Arkansas Pharmacists Association president is really a unique perspective. And
It's a blessing.
We're so glad you're in that position to have that dual perspective. One of the things you said reminded me of Attorney General Rutledge. She's mentioned a couple of times I've heard about how, that pharmacist who's coming to deliver that medication at 3 in the morning or opening the store at night, that's an independent community pharmacist that's doing that. You had that experience?
Yeah, definitely. I think all of us community pharmacies and all of our pharmacists, we've all had that experience.
Absolutely.
That mom who's standing there with the sick child and mandatory mail order cannot take care of that baby.
Oh, the mailbox isn't there at
No.
3 in the morning for him, huh?
No.
Kristen, we
definitely
do
not.
have a question coming in for you from the
Yes.
audience.
Okay.
Yes.
Let's just say they rule in our favor. We're going to be positive tonight. The Supreme Court justices rule for Leslie Rutledge, the AG from Arkansas,
Yes.
and we win. Are we done?
No.
Are there other steps for our state to take?
Absolutely. So once we win, then we still have work to do. And there are laws that need to be passed, and we need to work with our state legislature, and then on a national front, we have a lot of work to do. And so we will continue the fight.
And then the next question, either one of us here, but has the Arkansas Pharmacists Association been helping the Attorney General's office, and what have we done to help make this case happen?
Sure. I think it's been exciting as a pharmacist and a pharmacy owner in Arkansas to watch our pharmacy association in Arkansas work with our AG's office and also with NCPA.
Yeah, Jen Mallon, Mustafa, Doug, his team.
Absolutely.
Yeah.
And it's exciting that the AG's office can name the names of the Arkansas Pharmacists Association and NCPA both. It's wonderful collaboration.
The AG's office, Nick Bronny, the Solicitor General, Sean Johnson, who argued the case at the 8th Circuit, and then before that at the district, they know our pharmacists by name. They know Christy Reed in Jonesboro. They know Michael Butler in Hot Springs Village and Bob Geyer over in Mena, all three of whom testified or gave deposition in the earlier courts. And we have just worked hard to especially with NCPA's legal help, with your expertise, not only in Arkansas but around the country, to work closely with the AG's office.
It's been a great collaboration. And there is so much, I mean, this is the first shot across the bow, I guess, but there is a lot more work to do, but everything starts with the first step.
That's right.
Not that there haven't been many first steps and
Many
other
steps.
legal cases, but this is the biggest one.
Yes.
This is by far the biggest one.
Absolutely.
Yeah.
Thank y'all.
All right.
Thank you,
Thank
Kristen.
you.
Thank you.
So I think,
And next,
John,
yes,
you've got
sir.
some special guests.
We do. We have special
may,
guests.
You may
and-
know. I
Yes,
know them,
sir.
but you know them better than me here.
Yeah, it's great to see you guys. We're in Washington, D.C., right in front of the U.S. Supreme Court, and we have a couple of special guests from Arkansas joining us today. Go ahead and introduce both of you, and then we'll probably start with Michelle first. So we have Representative Michelle Gray, who is a state legislator from North Central Arkansas and primary sponsor in the House from this law, Act 900 of 2015. It's being argued before the Supreme Court. I'm confident this is her first law to come before the U.S. Supreme Court, so congratulations, Representative Gray. We'll go ahead and go to you first, and then we'll come to our second guest in just a minute. Michelle, if you wouldn't mind, just say hi to our audience.
Yeah. Hello, everyone. I wish I was there. I wish we were actually being heard actually in D.C. Crazy things happen during the pandemic, I guess. But no, I'm super excited for tomorrow. I know it's a day we've been waiting for a long time. And I ran this bill back in 2015 as a freshman legislator. I like to say that I wasn't quite sure where the bathrooms were yet as I started working on this, but local pharmacists up in Izard County in North Central Arkansas came to me with issues probably my first month into office, and I started working with the Pharmacy Association, and we drafted this bill, spent a couple months in hard advocacy and fighting for it. And I don't remember the numbers in the Senate, but I know in the House we passed it with 64 votes and had about an hour and a half floor debate that got pretty heated. So that was my first experience with PBMs in general, was this bill right here. Just for reference, in 2018 in a special session, the PBMs were acting badly, and we passed a bill that essentially regulated them, put them underneath the insurance department. And just for contrast, we received in the House 92 out of 100 votes. So just to show, from 2015 to 2018, went from 64 votes to 92. And that just shows that what we did in 15 has helped educate the legislators, the general public, employers, everyone across the spectrum as to what the issues have been over the last 15 years or so. So it's just exciting to see this finally come to fruition, and I'm looking forward to hearing the final outcome.
That's awesome. I agree with you. We've come a long way educating state lawmakers. We've still got some work to do with employers and others to have our voices heard.
Yes, we do. And I tell you, the one thing I always have said about this bill, and in 2018, was the advocacy that we had from the pharmacists. It didn't matter if they were independent, chain, hospital. Everyone came to the table and advocated to pass these bills. So pharmacists are actually, I guess, probably one of the biggest advocacy groups that I've ever worked with in the 6 years I've been there. So kudos to you guys.
Well, congratulations, and thank you for your leadership, and we will continue working with Representative Gray on all of these issues. So thank you for joining us.
Thank you.
And then next, Senator Jason Rapert from Central Arkansas in the Conway area. He is a state senator and chair of Insurance and Commerce, and been working on this issue that we're here before the Supreme Court today for many years now. He also brings a national perspective, as he was president of the National Council of Insurance Legislators, or NCOIL, in 2018, where model legislation was passed to spread throughout the country. And I'd love to hear your perspective tonight, Senator Rapert, on that.
Well, thank you for having me with all of you. And I've been there on the steps of the Supreme Court before. I wish I could be there with you. But you know, John, I think it's fitting that I'm standing out here in the middle of Arkansas the state, obviously, that this case is coming from and emanating from, coming before the Supreme Court. And I don't know if you can hear, but there's a hound running behind me. And I wonder if it might feel like PCMA with the hounds after them across this country, because people know that the game is up with them. As you know, PBMs have been very bad actors, and we are fortunate that people like Representative Gray and Senator Caldwell led the bill, which is now emanating into the Supreme Court on the case that you're looking at now. And of course, I've come along in the Arkansas Senate as the Insurance and Commerce Chairman and done my part to get behind this and support pharmacists, not only here, but then at the National Council of Insurance Legislators, where we passed the first model bill to regulate PBMs through insurance departments in the country. And I'm very happy to report that we now are told that over 40 states have filed bills off of that model, and I think over 240 bills.
Yeah.
But this case, just like NCOIL's amicus brief, and I'm very happy in our entity that filed an amicus brief in support of the state of Arkansas in this case. This is a huge case, not only for our state, but for the entire nation, John. It's going to be important, obviously, for pharmacy, but it's important for states' rights. The individual states should have the right to regulate this marketplace in our states, and obviously, if the Supreme Court rules broadly, it could be a major decision for ERISA in general across the country. And so I'm very happy for all of you. You put in a lot of work, and I am praying for victory tomorrow at the United States Supreme Court when they release their decision in the future. I hope it's going to be in your favor.
Thank you very much. Any questions from the audience?
I actually have something else.
Go ahead.
Senator Raper, this is Doug Hoey. I saw you last week. It's good to see you again. I just want to say special thanks on the NCOIL, the model legislation. I know Ann Cassidy from our staff and others worked with you on that, but it was through your leadership and your colleagues' leadership, of course, that made that possible. So you mentioned that's 40 states have run that model legislation, and we just appreciate that so much. So thank you for that leadership.
You're welcome. And we just talked about this case when I was in Virginia the other day, and we're going to continue to work on this issue because we have seen PCMA ramp up their lobbying efforts across the country. And so I encourage community pharmacists everywhere, don't give up and don't give in. This case probably isn't the end. We need to make sure that we stay vigilant to protect the rights of consumers and independent pharmacy across the country.
Yeah, the throwdown's just started.
So Senator Raper, we heard from Representative Gray about what, one of her pharmacists came to her, got her involved early on. We had a question from the audience. Was there a moment that got you, to take hold of this issue, or can you recall what made you get in this fight against the PBMs?
I say it was several moments, but I was just thinking, and I'm glad you asked this because I didn't know how much time I would have to say things, but I cannot help but think of my local pharmacist, Dr. David Smith, here in Conway, Arkansas.
That's true.
David did a wonderful thing, as you know, John. He wrote a letter to the editor called The Monster in the Closet. I have quoted from that letter to the editor at NCOIL in front of legislators from all over the country. I've quoted from and shared that letter to the editor at the NAIC, the National Association of Insurance Commissioners, and I hope everybody watching will look up Dr. David Smith, Monster in the Closet. He wrote a fantastic letter to the editor that I think really captures the heart and soul of this issue. It really speaks in a very layman's term about what we're dealing with. And I will tell you that Dr. Smith, if I had to credit one individual locally that really helped me to understand this, it would be him. He's a fantastic human being, a fantastic individual, and he is to be credited for his work and his voice in this issue.
Thank you very much for that, Senator Raper. We had another question come in for Representative Michelle Gray. Could you talk what it will personally mean for you if a piece of legislation that you and Senator Caldwell wrote together and presented was passed? It's hard to pass a law, as you talked about that hour and a half debate in the well during 2015. What's it going to mean to you personally as a legislator and for your constituents?
Oh, this is huge. I can tell you, after with that floor debate, that hour and a half, I think we finished about 8:30 that evening. That was the last vote of the evening. as I watched the board and watched it light up, and I'm counting just to make sure I hit 51. And when they called it, and I knew what my number was, I started crying.
Wow.
And anybody that knows me knows I don't cry. And I started crying, and I went to the back, and all the legislators came back and hugged me and told me what a good job I had done, and essentially what a hard fight I had fought. And I think for me, we're now almost 6 years in. If we were to be victorious on this and get the ruling that we look for, essentially what it means to me is that I actually matter, that what my constituents bring to me, I can actually affect change on. It's very frustrating. The bill process is very arduous, and this would just mean it makes what I do worthwhile. I'll put it that way.
That's amazing.
I've got a question for both of you. So Representative Gray and Senator Raypert, so we've got viewers from all across the country that are watching, and they've seen the good work that you've done in Arkansas. What made this issue pop for? I mean, there's plenty of issues in the state to take on. What made this particular issue stand out that you decided to tackle and champion? I guess I'll say.
Great.
Okay. Yeah, I'll start first. It just started with my local pharmacist coming to me and telling me what the issue was, and then I actually serve in the House with Justin Boyd. He's a pharmacist from Western Arkansas, and so as I started talking to him and he explained the issue to me, I knew we had a problem, but I got to tell you something. I'm a lot like Senator Rayford on this. All I need is for somebody to fight me and tell me I can't do it, like the PBMs did. I had meetings with CVS, Express Scripts, multiple companies essentially said you can't do it, it's not been done. We'll come to the table, let's talk. And then, 4 talks in, you've not made it anywhere. Once I saw what I was up against, I knew it was the right thing to do.
That's a great answer.
Well, I will echo that with what Representative Gray said. From my perspective, I can tell you that if you can hear me, hey, somebody can let me know if
Yeah.
you can hear me talk.
Yeah, you
good.
sound great.
Yeah.
Good. What I wanted to say is I want to echo that is because I will tell you what brought me to the table finally when I really realized what they were doing. And when I saw some of the letters they had written to independent pharmacists where it felt like they literally were being shaken down by the mafia. This is CVS letters that were sent to these people, and I think it was CVS and not Walgreens, but it was letters from the large PBMs, and they said, look, they're paying them less than the cost of the medicines, and then they're basically almost strong-arming them into selling their businesses. And when I saw that unfairness, and when I began to realize that in this healthcare arena, I've said it many times, doctors answer to medical boards, pharmacists answer to the pharmacy boards, insurance companies answer to insurance departments, but the PBMs answer to no one.
Yeah.
And they needed to have some regulation. And I know Act 900 is dealing with a different aspect, but what you see is really bad actors. So when I realized that this industry is really taking advantage of people and creating a situation where consumers were being penalized, that was all that I needed. And of course, when I come together and got the perspective of Representative Gray, Senator Caldwell, and all the others, and I want to also give a shout out. I didn't get to see her on this program, but I believe Kristen Riddle has been there with you, John. She's a constituent here in my community, and she is, I believe, the president of the association out in Arkansas. Hearing from her and her family that has been in this business for years, it made all the difference in the world, and I just thank everybody for helping us, helping Representative Gray, helping Senator Caldwell and the legislature, helping us know the facts so that we could go fight this battle, and it's a battle I was proud to be a part of.
Thank you, Senator Rayford. Thank you, Representative Gray. You're amazing for being here this evening to join our program. We appreciate everything you're doing and look forward to working with you in the future, no matter what the outcome. But to your point, if these justices rule the other way, there will remain in a regulatory vacuum where they don't answer to the state and they don't answer to the federal government either.
Right.
So that's really a problem. Thank you for being with us here tonight.
Thank you.
Doug?
Thank you. Thank you very much. We'd like to introduce our next guest, who's a longtime colleague and friend, Becky Snead from the National Alliance of State Pharmacy Associations. Welcome, Becky.
Hey, Becky.
Hey there. Thank you for having me.
Absolutely.
Long, hard battle, for sure.
Yes, yes. So, Becky, can you talk a little bit about what a favorable ruling would mean for the different pieces of legislation that are out there in the states? Maybe just describe what's out there in the states right now.
Well, just about every state in the nation has passed PBM legislation. Several different attempts to regulate the PBMs. In many, it's almost like playing whack-a-mole. As soon as you try to regulate one practice, you have to regulate another practice scheme that they come up with. And it really is all about patients. And this goes over 3 decades that state pharmacy associations and state legislators have tried to rein in the PBMs. So having a favorable opinion with the Supreme Court will help give us some clarity. We still have a lot of work to do, as Kristen said, but it will give us some clarity. So we are just really anxiously awaiting tomorrow and then subsequently the court's ruling.
Yeah, thanks.
I know our state associations all across the country have played a big role in passing that legislation, but I know Garth is here from Illinois. Becky, thank you for being here.
Absolutely.
We're only as strong as our members, though, if you want to comment on that.
Yeah, I think that it's just really amazing how, with the support of NCPA and our national pharmacy organizations, we have just really taken on behalf of our patients, more so than trying to stay in business ourselves. We have seen what this has done to our patients, being taken out of their communities where they've gotten care for all of their lives. I grew up in a very small rural community. I can tell you, if they told my mom that she couldn't get her prescriptions from Al, then she would have been devastated. And it would have caused her tremendous emotional harm, not only in not being able to go and get her prescriptions and all of the knowledge and health care that he provided her, but also just the trauma of not knowing whether they were going to be able to deliver it on a snowy, cold day in rural Virginia. It is not from the faint of heart for anybody that relies on the mailbox to wait for their prescription drug.
Becky, for NCPA, PBMs have been our #1 issue forever. In fact, we've got the U.S. Capitol across the street from us here, and there have been times when the legislators there, as smart as some of them are, couldn't spell the word PBM. But through the help of the state associations and the federal lobbying, that's really changed. Can you talk a little bit about some of the tactics some of your members have used to help educate not only the state legislators, but maybe some of their federal legislators as well, and then how that's echoed back with NCPA's message on a federal level?
Yeah, I think that, it's been a journey. And I think that our 2 representatives from Arkansas said it the best. It's about people in communities going and talking about their patients and the impact that it's having on them, and it's also having on their businesses. And I think that when you tell a story and you have an issue that you've been fighting for over 3 decades, PBMs can actually now can say that what a PBM is and what a PBM doesn't do, and how they're not regulated by the state or federal level. And that needs to change. And the states, and this is about what this case is about, is clarity whether the state has the ability to regulate some of the activities of the PBMs.
Yeah, absolutely. Yeah, because they want it both ways. They say, well, you can't regulate us. We're exempted by ERISA. Well, but then if you're exempted by ERISA, don't you have a fiduciary responsibility? Oh, no. We don't have a fiduciary responsibility. So, well, which is it, PBM?
Right.
You a plan or PBM? Make up your mind. This case should help provide some clarity on which thing they're wanting to morph themselves into.
And it just takes one of the arguments away from them. I mean, we've been going around and around. I said I used the word, we've been playing whack-a-mole. I can't think of a better term to describe what it feels like that we've been through for the last 3 decades. But it really is going to provide some clarity and removes a very, very substantial argument that they have placed and have taken many state associations into court over.
Yeah.
Becky, at the risk of leaving someone out, we have a question from the audience. Do you have some context or share some examples of some of the states that have maybe done the most, or maybe good states to look for laws that may have been passed? And I know it's a lot of times it's reflective of who's chair of insurance and commerce and which legislators are elected. It's not just as simple as
Present company excluded, right, John?
Present company excluded.
Right?
Leave Arkansas out. Who are some other states that have been leaders in the PBM reform world?
All of them.
That's a good answer.
All of them. As I said, for almost 3 decades, all of them. But I think that, if you want to know where the nerves have been hit, look at the states that have been sued.
That's a great, yeah.
And that's the other states that have passed legislation, which have been incredible over the past 3 decades, but they have been very incremental in how they start chipping away at the unfair business practices, as well as the lack of transparency and the impact that they were having on patients. So if you want to know which states have struck the biggest nerve, look at the states that have been sued.
Well, and in recent, that's Iowa, Arkansas, North Dakota, and Oklahoma that have been sued. And that's not to say that those are the only 4 states, to your point, but those are the ones that at least cut closest to the nerve as far as resulting in being on the steps here in front of the Supreme Court.
I think it's cool too, on the amicus briefs in support of Arkansas, 47 AGs, 45 states, then Arkansas and DC all weighed in favor. So that's a testament to the AG's office, to NCPA, national partners, and also our pharmacists in all states across the country having those relationships with the AG's office to encourage them to weigh in support of this case.
Yeah. Well, and I think that, having such state support goes to Senator Rayford's comment that this is really a state issue. Mm-hmm. And, the PBMs will argue, well, we need one national, you can't have states making up their own minds. You can't have states thinking independently and doing their own thing. We need
states do.
But that's their argument. That's their argument. It's going to cause chaos and chaos in the streets if we have less than one rule that preempts everything.
Right.
So, but that's their argument.
Well, that's one of the things that makes this country great. Those folks that have boots on the ground, small town USA, often know what's going on, and not necessarily the folks that aren't in the trenches in the local communities.
Well, and here we are in Washington, D.C. on that note, John. So thank you, Becky, very much. You were awesome. Thank you.
Yeah, absolutely.
Yeah.
Come on up.
Yeah.
This is Dr. Scott Knoer from the American Pharmacists Association.
All right,
welcome,
good virtual
Scott.
high fives.
High fives.
All right,
Yeah.
nice job,
Yeah.
guys.
Great you're here. Great
We aren't popping corks yet, but it is an accomplishment just being here. So thank you both for, fighting this fight for so long.
Yes, sir. We're so happy you're here.
Yeah, glad you could be here. Now, Scott, APhA represents pharmacists from all walks of life. You've got chain pharmacists, you've got community pharmacists, military, academia, hospital, managed care, lots of students. How would a change to the law, how would this law that would finally have PBMs, have to answer to something, how would that affect all of the pharmacies across the country?
Yeah, well,
pharmacists across the country.
Pharmacists, it's so broad. And before I got here, I was chief pharmacy officer at Cleveland Clinic for 9 years. Mm-hmm. And I had 19 community pharmacies, specialty pharmacy. I imagine it's even worse in 2020, but in 2019, the last full year I was there, DIR fees. We had $6.5 million stolen from our health system. Mm-hmm. And that's money you can't use to, pay for doctors and CT scanners and all that. Chain pharmacies, you've seen Ellen Gabler's article on chaos in chain pharmacies in the New York Times, right? Well, the whole thing, it's the margins. That's another issue, but this is part of the reason. Margins decrease, and everyone's got to work harder. They cut staff. This is just a horrible situation. And being from Ohio, again, most recently, I represent all states, Arkansas, thank you, you're amazing, now, but Ohio was kind of ground zero, really, for exposing the shenanigans going on at PBMs. Antonio Chacha, who we just brought on as a senior advisor, the little tiny Columbus Dispatch, local newspaper in Columbus, Ohio. Antonio fed them, you guys know all that, and we showed how much money's being sucked out. Okay, it's ridiculous. One state, Ohio, one Medicaid program, 1 year, $244 million of spread that the PBMs are keeping, right?
Yeah.
And your members, our members, are not getting. So, and you got spread, you got DIR fees, you got rebates. You were talking about the numbers before, approaching $1 trillion. Mind-boggling.
In this case is about employers.
Yep.
So if the money is being stolen from local communities and from employers, they're not getting the care that they are supposed to be paying for.
Well, and this hits to Ohio. You're talking about states, and you talked to Becky, pharmacy patriot Becky Snead, wherever she went. But in Ohio, they passed a law, a MAC transparency law, and a part of that law was that you had to let payers know, right, your self-insured payers, how much spread there was. They sure didn't want anyone to know that, right? So, I mean, this is going to impact, so employers, insurance, goes up, and that's not going to the insurance company unless they're all integrated, where the insurance company owns the PBM and owns the chain pharmacies. But this is so far-reaching. The implications are enormous.
Yeah, Scott, now for a long time, it's been, when it comes to PBMs, it's been mostly the independents and the chains that have been screaming about PBMs for a long time. But I've definitely noticed a change of tone from all facets of pharmacy. Now, what do you think has clicked to make that change where it's practically everyone, with some exceptions, in pharmacy that are screaming about PBMs versus where it was maybe a few years ago, where it was really the retail guys who were getting hammered?
Well, they were the canary in the coal mine, right? And you know this because your members, our members. I'm not real good exact numbers, but between 2005 and 2000, whatever, there were like almost 10,000 community pharmacies that closed. I know in Ohio alone, in the last 3 years, we had 200 net pharmacies closed. But I think it's stuff like we saw out of Ohio. The outrage when people see the huge sums of money being sucked out of the healthcare system, and that impact. I was a taxpayer in Ohio, right? I was paying taxes, right, for Medicaid that went to enrich Larry Merlot and the whole gang. I mean, he's making enough money.
Right. So you think that's caused
I think the outrage.
Everyone from pharmacy?
They're understanding, Doug, just how big it is and how broad it is, how it impacts. It's raising healthcare costs, right? Okay, right now we're having major problems with underserved areas. Community pharmacies a lot of times are the only healthcare facility in an underserved area. They're going out of business. We got pharmacy deserts.
Well, and you mentioned the Cleveland Clinic experience. So some of the health system pharmacists, they started getting impacted in the last few years. And I think even our schools of pharmacy, I think indirectly have been impacted, if for no other reason. Pharmacies are closing, so you have fewer experiential sites.
Absolutely.
So it's had this ripple effect, and you're right, it's been the community pharmacists and the chain pharmacists that have been the canaries in the coal mine.
Yeah, but it impacts everyone.
It has now hitting everybody.
Everyone, so any employer, right? If they're self-insured, we were self-insured at the clinic. PBMs were stealing money from us. I mean, not technically, it's legal, but it's like legal theft.
It's a sleight of hand.
Yeah, my God, yeah, and you're right. It's like, oh, don't look over here, and the man behind the curtain, the lack of transparency. So what you guys doing is huge. Thank you both for the amazing work you've done here to get our pharmacists taken care of.
Absolutely.
Well, thank you for joining the fight. The American Pharmacists Association, of course, has been a big part of our amicus brief, along with NASPA, with Becky that was just up a minute ago. And we've been working on this collaboratively for all pharmacists across the country.
Mi casa, su casa. You guys are here. Come to the World Home of Pharmacy. Use our internet, use our conference rooms, anything we can do to support you in the good fight.
Scott, I mentioned provider status a few minutes ago. And so, gosh, it's been now 6, 7, 8 years ago that NCPA, ASHP, NACDS, Walgreens, and APhA formed the, so I can get this acronym right. The PAPCC, Patients for Access to Pharmacist Care. Yes. And APhA has really been the leader on provider status. And so how would not passing this law, but if the Supreme Court ruled affirmatively, affirmatively from our standpoint, how would that affect provider status?
Yeah, well, in a lot of ways. A lot of the states are passing laws. Again, Arkansas states, they're passing PBM laws, they're passing provider status laws.
Right.
And things like we're doing in Ohio, we're actually getting insurers to pay pharmacists for cognitive
Slowly
function.
but surely, we're
Slowly,
getting there.
But
Yep.
we're getting there, and
Yeah.
that's why we brought Antonio
Absolutely.
from the Ohio pharmacists over. You know, the dam's breaking, right? We're starting to see leaks are coming out. But I think, quite honestly, some of this horrible press the PBMs have got, a lot of times they own the insurance companies too. They're like, you know what? You know, pharmacists, this is something benevolent we could do for society. They're not benevolent by nature, but if they can do something, and if we can help them pay pharmacists to take care of patients,
Right.
then we're all about that. So, I mean, part of what you guys have stirred up here is it's created a lot of bad publicity. So now we're like, okay, guys, come to the table. Let's pay pharmacists to do what we all went to school for.
Right, which is really the future of pharmacy, is getting
Absolutely.
paid appropriately for the product, but finally getting paid for the services
Yep.
that we provide, which
Yep.
basically
And-
are free,
and
or
another
given
thing-
away
And
for free.
dispensing fees, even in the community setting, have just disappeared.
Yep.
I mean, they've gone literally to
Oh, yeah.
nothing. And we do have a question from the audience, Scott. Win or lose, what do you think the next steps are? Do we need national legislation? You talked about getting them to the table
Yep.
to negotiate, but do we need national legislation?
You know, we do, and we need to continue to fight. National legislation, it's tough. Well, usually from my office, I can see the Capitol.
It's right there.
You throw a rock to it,
Yeah.
getting anything past there, oh my God, it is difficult. But, the next steps are just to continue to fight. I think the thing that we're doing, again, Antonio, is transparency. That his company, 3 Axis Advisors, are showing just how much money's there, because people never knew, right? So I think so absolutely pushing for laws, but just continue to show the taxpayers, the insurers, the insurers, yeah, I mean, they're getting it too, right? I mean, self-insured
Yeah.
employers. It's so bad.
Yeah, and I think a big part of that story too, Scott, is making sure that all of our pharmacists / lobbyists, when our pharmacists, all the community pharmacists are lobbyists, that's part of their job. You're
Yep.
either in politics or you're out of pharmacy.
You are.
That part of that story is not only about their business, which is of course, very important, but how it impacts the patient. Higher costs, poor health care,
Yeah.
and that is so essential that we make sure that our dialogue as a community of pharmacists is talking about the patient and putting that first, because
Yeah.
if you're a legislator, how can you deny your constituent is getting worse care and paying higher
Yep.
costs when you've seen what's happened over
Yeah.
the last 30 years of PBM overlords?
Well, and the realistic, we have some community pharmacy owners here. The realist, you used to be able to talk to patients, right? I mean, you had time because the reimbursement, you weren't getting rich, but
Right.
you could pay
You
the
made a
bills.
fair living, just a
made
decent
a fair
living.
and you can't, and that's what's caused, you got drive-throughs,
Yeah.
and you got all
well, the
the
New York Times article that you
Absolutely,
referenced.
absolutely. So, this is going to be a huge part of that. But it's so we need that so pharmacists can spend time counseling, and we need to be reimbursed for again what we all went to school for
Right.
the cognitive function,
Absolutely.
provider status, PBMs. It's all intertwined. It's all what it really is. Okay, it's payment reform. Okay,
Yeah.
my board of directors, you got a board of directors, we
Yep.
all have boards of directors. They just met. The number one issue for all of us, I'm sure, is payment reform. That's one, the PBM stuff. It's also provider status.
Yeah. Well, changing the pharmacy payment model. So
Changing the pharmacy payment
welcome.
model.
I mean, that's been our mantra here at NCPA for several
Yep,
years
that's
now.
the best thing we can do for our patients, for society, for taxpayers, for
Absolutely,
everybody.
because it's not just about the pharmacy that we need, for which we need
It's
to
about
change the
community.
pharmacy payment model.
Again, the only healthcare facilities in a lot of communities, underserved
Yep,
communities,
yep.
and pharmacy deserts. We got pharmacy deserts, where you can't get care. It's horrific.
Patients don't understand this, and it's complex, it's cumbersome, and most of all, it's covert.
It is covert. It is
And
covert. We're in
patients don't
DC. Lots
understand
of
it.
stuff's covert
Yeah,
around here. So.
yeah, yeah. That's true.
And
That's
it
true.
impacts the pharmacists as patients too.
Absolutely.
As employees.
Yeah.
I got a call about a week and a half ago where the medical director at the hospital was asking the pharmacy director, "What's the deal?
Yeah.
I've got an autoimmune disease. Why can I not fill my prescription here at the facility?"
We don't even talk about steerage.
I know.
Okay,
yeah.
I mean, right? I mean, my God. So again, at the clinic, right? We had our own specialty pharmacy. We might be able to fill a first dose, but then they're transferring scripts, and we can't take care of our patients. We can't take care of them in our community pharmacy. We can't take care of them in our health systems because they're not only stealing money from DIR fees and spread and rebates, but you and as again. My new buddy, not my new buddy, but Antonio, showed in Florida, right? They're paying PBM-owned pharmacies are paying their own pharmacists, and they're not steering everything. The stuff you don't make any money for, they're letting the community pharmacist take
the lisinopril you can have. Yeah.
Not that one patient's more important than another, but this was the chief medical officer.
Right.
I'm being forced to a healthcare facility I don't want to use.
Absolutely.
Yeah.
It's ridiculous.
That's actually going to be a great segue for our next guest, Scott. So we appreciate.
All right.
Thank you very much for being here.
Thank you guys so much.
Yep.
Join Arkansas. Join our Community Pharmacy Association. We don't get here without people fighting for you. Everybody on here, renew your dues. We're fighting for you. Help us fight. All 50 states, right? Becky,
Yes, they
where's
did,
Becky
all
at?
of them,
Her, support us. We're supporting you.
Amen, brother.
Amen.
Thank you.
Thank you.
Thanks, Scott.
Yeah, and thank you, Scott, for that.
Excellent.
Yeah, and I'd like to introduce our next guest, Eric Shumsky.
Thank you very much for having me.
Yeah, well,
Welcome, Eric.
this
Thank you.
Eric is, we're delighted you're here, Eric. He's one of the top lawyers in the country. Legal 500 calls him one of the finest appellate litigators in the nation, and especially relevant to our being here in front of the Supreme Court. Reuters identified Eric as part of an elite cadre of 75 lawyers out of 17,000 who are the most influential members of one of the most powerful specialties in America, the business of practicing before the Supreme Court. So I couldn't think of a more perfect guest to have here with us today than you, Eric. So
Well, thank you so
thanks
much.
again. Thanks so much for being here.
Pleased to be here.
So, Eric, just a little bit of operations. Tell our listeners what to expect tomorrow in terms of, how does the mechanism work for the state of Arkansas, the U.S. government weighing in, PCMA? How's it going to work tomorrow?
Sure. So it's a little bit unusual, actually. Normally at the Supreme Court, it's kind of organized chaos, and you're standing up there, and there are the 9 of them, or now the 8 of them, and they're all firing questions and interrupting each other. They're doing all the arguments virtually right now, and so they've kind of changed their process. They're doing it in 3-minute chunks, and they go in order of seniority. Each justice gets a turn to ask each side their questions. And so the state of Arkansas will have 20 minutes, federal government will have 10 minutes.
Does that always happen where it's the federal government and the plaintiff?
No, so the United States is not involved in every case. They came into this one. They tend to come into cases where there's an important federal interest. And so let the motorcycle go by. In a case like this,
PCMA CEO right there.
Exactly. In a case like this involving preemption, where you've got an argument that a federal statute totally wipes out everything that the states are doing, often you get the federal government coming in to express their view on it. And so I'm pretty sure that what happened here was a lot of people went in and talked to the United States Department of Justice and said, look, we got a really important issue here. It's really important to have the voice of the federal government here. And so the United States agreed. They filed a brief, and so they're going to be a part of the argument.
Interesting. So can you talk, Eric, a little bit about the dynamics of, so it's virtual, you mentioned that, versus live, maybe that dynamic. And of course, the one that really stands out is we have 8 justices. And so can you talk about how that dynamic may affect the outcome of this case?
Sure. So we'll talk about the virtual setup first. As I was saying before, it's really a lot more kind of sedate. When you're arguing in the court there, it's really intimate. You're very close up to the justices, and you're able to have a conversation with them and a give and take. Here, they're doing it not even by Zoom, it's just audio.
Wow.
So the advocate is sitting there listening to the question.
So they could be in their pajamas arguing this case.
Well, so as a matter of fact, one of the arguments in the spring, there was an audible flush that they heard on the audio. No one quite knows who it was. No one's fessed up, but everyone's assuming it was one of the justices. So having 8 justices obviously is something that's really important here, and that could affect the way this all plays out in the coming months.
So we won't have a 9th justice tomorrow, but any possibility if a 9th justice is confirmed by the Senate that person would have any weigh in on this case?
Yeah, absolutely. So typically what they'll do is they'll go back and vote, and if there's a majority out of the 8 then they'll just go ahead and decide the case with that group of people. But if they're split 4-4, then often what they'll do is wait for the new justice to be seated, certainly if it looks like one's going to be seated soon, and then often they'll have re-argument. And I'm sure for all of the members who are eager to get an answer here, this is not welcome news, but what will sometimes happen is it'll take a while, especially if the confirmation takes a while. And so, for instance, a colleague of mine argued a case before the court with Justice Scalia in a January, and then the case was re-argued the following October once Justice Gorsuch was on the bench.
Wow.
Eric, can you kind of lay out some different timeline scenarios just based on all the different variables that we're dealing with here?
That's easy.
Yeah, right.
So, well, we'll start with the simple version. So if there is a majority out of the 8, then ordinarily for a case that's being argued this time of year, decision will come out December, January at the very earliest. February is probably a little bit more in the sweet spot. If they're waiting for a 9th justice, then they've got to wait for the justice to be seated. They've got to wait to re-argue the case. And at that point, kind of all bets are off.
Is there like could it go for, couldn't go for years and years though, I mean.
No. So the court sits in terms. They sit from October to June. Ordinarily, they try and get all of their decisions out by June. So worst case scenario, if this rolled over to next year's term and they were re-argued it next term, then it would be decided by the following June at the latest.
Okay.
I know that one of the things you heard a little bit today earlier in the program that a lot of pharmacists are frustrated with, it may not be germane or exactly what this case is about, but it's about the anti-competitive nature, the unfair nature of the David versus Goliath. Will any of that storyline or that frustration of a PBM owning its own pharmacy and paying itself more than the small mom and pop pharmacy from anywhere USA, is that going to play at all into the case or into the justices' minds and how they maybe do the oral arguments or questions they may ask?
Sure. So it'll play in differently for different justices, but it absolutely can be a part of the decision. Remember, they're looking at this federal statute and they're interpreting it and trying to figure out what Congress had in mind. So different justices will do that analysis differently. Some of them will focus much more just on the words of the text. Here, ERISA is kind of a mess, and so most justices are looking for clues in other places. And so that kind of a story, what's going on here, what would make sense, what would Congress have wanted, how's this playing out in the real world, that'll end up having a real effect as they think about, what Congress had in mind here.
I hope it does, because we're on the side of good. If
Yeah,
that's the case.
right. If good trumps evil, then we're on the right side. So, Eric, could you talk a little bit about? So, there's obviously a lot in the news about President Trump appointing perhaps a 3rd justice. Very likely he will. And of course, there's a lot of political accusations that go with that. That one favors, one leanings or another. Are there does it matter, I guess, because some justices are thought to be conservative, some are thought to be liberal. Does this particular issue lean towards the conservatives? Does it lean toward the liberals? Where does it fall on that spectrum?
So this question of preemption, when you're trying to figure out whether Congress took something away from the states, can often be pretty splintered. So you get one set of divisions between, people who may be more favoring federal power and others who may favor state power more. And that can often be sort of, stereotypically liberal justices more in favor of the federal government, conservatives a little bit more in favor of federalism. But then in all these cases, you have the question of what's actually being preempted. And, in a case like this, where you have this story about a little guy, that may be something that actually, again, just sort of speaking generally, could appeal to some of the liberal justices. And where you're talking about small businesses and the effect here on local communities, you know, that can kind of play in the opposite direction. And so it's one of the reasons in these preemption cases you often see these splits and these splinterings all over the place, because they don't necessarily line up along kind of traditional liberal conservative lines.
Yeah. Sort of in the legal world, what's the interest in this case? I mean, so you look at the lineup of the cases and you see some that are going to have swarms of media around it. This probably isn't one of those, but just from the legal community, is there a high level of interest in this case, or where does it sort of fall on the spectrum?
Yeah, so it's funny, you know, this question about ERISA preemption just keeps coming up over and over and over, and it's been coming up for a lot of the reasons you've been talking about for the last while here. It affects a lot of people. There's a huge amount of money at stake. It affects a lot of businesses, and so, you know, speaking against interest here, you get a lot of money involved and a lot of people involved. You get a lot of lawyers involved, you know, because these issues are important and they do affect a lot of people. So I do think a lot of people will be watching where the court is on preemption, and especially if you do end up with a Justice Barrett on the court, people will be looking at tea leaves, trying to figure out how she views these state federal issues.
Yeah, great.
So when you look at the amicus briefs, you had, you know, on both sides there were amicus briefs, obviously, but on our side you had patients, you had physicians, you had pharmacists, you had advocacy groups for patients and others, and we're just really, really excited to have all that support. And so from our perspective, it's the most important case the entire term. I know there's others that general public may pay closer attention to, but in our world, this is extremely important because it's not just about money.
Right.
It's about healthcare. This is not just a commodity. This is about life or death.
Right, because on the other side you had the U.S. Chamber, you had the Society for Human Resource Management, and of course all the insurance plans on the side of evil, bad.
Well, and it's a great point about the amicus briefs. I mean, you know, that's something where people have to put their money where their mouth is, right? You got to decide whether you want to go to the effort and the expense of filing those briefs. And usually when you have a lot of people filing them, it means there are a lot of people who are really interested in how the case comes out.
Yeah. Well, Eric, thank you very much for
Totally
lending your
my
expertise.
pleasure.
We really appreciate it.
Great. Thank you
you
for
so
having
much.
me.
Yeah.
Excellent.
Appreciate
Thank
it.
you, Eric. Nice to meet you.
Well, John,
Let's do it.
we've come to the end of our pregame show, and it's been great riffing with you here and talking with you and continuing the partnership. Excited about tomorrow. Any last thoughts before
Well,
we wrap up?
I just want to thank our audience for being with us. Our associations are simply megaphones for our audience and for our members.
Yeah.
Without the grassroots effort of our membership, those relationships with state legislators, with your attorney general, with your governors of your states, none of this happens. That's the kryptonite here to the other side. That is our secret sauce
That's
to
right.
victory is you.
That's exactly right, John. We couldn't do it without our members, and that's why we do it. I want to thank our guests. We've got a lot of guests to thank. Kristen Riddle, Arkansas legislators, Representative Gray and Senator Rapert, Becky Snead from NASPA, Scott Knoer from APhA, and of course a guest to Eric from ORIC, who provided a fantastic legal analysis. We'll be back tomorrow afternoon, post-hearing. We'll be live again, and again we'll have Becky, we'll have Scott, you and me, and talk about what we heard, as well as expert legal analysis to share with us their perspective. So, big day tomorrow, and we're excited, and we're excited to see you tomorrow. So until then, take care and good night.